So our today's topic is active squamosal chronic suppurative otitis media. As we all know that chronic suppurative otitis media is the chronic infection of middle ear, and there are five types of chronic suppurative otitis media, in which active squamosal, active mucosal, inactive squamosal, inactive mucosal, and healed otitis media are included. So today we will discuss about active squamosal CSOM or cholesteatoma. It is also called cholesteatoma. Cholesteatoma is whitish keratinized material which is collected in the attic region. It can erode, it can cause bony erosion, it can erode the ossicles, it can erode the scutum. So we call it unsafe type of chronic suppurative otitis media. So in this picture, active schemosal CSOM is visible. There is cholesteatoma. As you can see, there is whitish material collected in the attic region. It is squamous. These are squamous epithelial cells. So it is indicative of cholesteatoma. Okay, how you have a patient, 45-year-old, with 1 year history of foul smelling ear discharge, which is scanty in quantity, and it is purulent. So how will you proceed this case, and what are your differential diagnosis? So our first differential after the history and examination in this case will be cholesteatoma, and the second one will be tubercular otitis media, and third one will be ear malignancy. So cholesteatoma, there are in tubercular otitis media, there are multiple perforations of tympanic membrane, and their granulations will be present. So we can differentiate it from cholesteatoma. In ear malignancy, there is blood stained foul smelling discharge, so we can differentiate it from the cholesteatoma. So how will you approach in this case? The next Viva question is, how will you approach the case? We will do ortho microscopy. So they can ask in Viva that why don't you advise ortho endoscopy? Because in ortho microscopy there is a benefit of suction clearance. Okay, what is the next investigation? Next investigation is pure tone audiogram. So they can ask why. I am writing all these why because in Viva, what you will say, you have to justify all your statements. So why will you advise a pure tone audiogram? The answer is for qualitative and quantitative assessment of type and degree of hearing loss. Okay, then they will ask you to what the question, what is the next step of investigation? I will advise HSCT temporal bone, and then again a why you will advise the HSCT temporal bone, because in this case I can see the extent of cholesteatoma, I can see the ossicular erosion, I can see the scutum erosion, and I can see the anatomical variation like low-lying tegmen, high-riding jugular, anteriorly placed sigmoid. This is very important because in low-lying tegmen, high-riding jugular, anteriorly placed sigmoid, all these anatomical variation are very helpful during surgery. So what are the other general investigation to prepare the patient for surgery? Okay, what will you do next? Next is counsel and consent the patient for surgery. Okay, and what is the aim of surgery in this patient? Next question is, the first one is simply to eradicate the disease, to prevent further extension, and to achieve a dry epithelialized self-cleansing ear. Okay, and the next is to preserve or improve the hearing. Okay, So in the next video we will discuss the plan of surgery and mucoplasty, menstrual obliteration, how menstrual obliteration is done, and canal wall up and canal wall down procedure. Okay, thank you.